Welcome back to New Jersey Power and Politics. I'm Alex Sedan. 5 people were killed last weekend by a gunman who entered a Colorado Springs club that has long been a safe haven for the LGBTQ community. In the wake of that shooting, my next guest wrote that hate is the most significant driver that diminishes public health. Dr. Perry Halkitis is the dean of the Rutgers School of Public Health. He also devised the COVID contact tracing program for the Murphy administration. Welcome back to the show, Dr. Halkitis.
Hey, Alex, happy Thanksgiving.
Thank you very much, Perry. I wanted to talk about this letter you wrote to the school in the wake of the Colorado Springs shooting. You say there's zero tolerance for hate. You also say, though, that rhetoric from political figures has enabled people like that shooter. How?
So, we have been seeing over the course of the last 4 to 5 years a steady increase in hate crimes, not just only against LGBTQ people, but against Jewish people, against people of color. And it is very clear that when you map this out, the data, map out these data points, you see a very strong association between rhetoric at the political level, at the federal level, and these crimes. And so what I wrote about in that letter was for us to think about how our work in public health has to be responsible enough to call out that rhetoric, whether it be macroaggressions like calling people by slurs or killing people, or the microaggressions that marginalized people face on a daily basis. It's very, very clear that hate, discrimination undermine the health of people, and as a result, the public health of populations most at risk.
If you're saying, though, that a microaggression is a public health issue, doesn't that make us all into epidemiologists in some way?
Well, what I'm saying to you, Alex, is that microaggressions are things like this. In the state of New Jersey, we do not collect sexual orientation and gender identity data when you go to the doctor. Why? I don't know. I've been given a dozen reasons why. There is no reason why this can't happen. When you go to a doctor and you're a gay person, a lesbian person, a bi person, a trans person, a queer person, you're a trans person, you're an asexual person, you should be able to identify that information to your doctor so that your doctor can treat you appropriately and use knowledge about you and your population effectively. It's a microaggression that we don't get that data. So it's not like I'm saying that we have to be epidemiologists. What I'm saying is that the words we use or the inactions that we take, in this case, the non-collection of SOGI data, is a microaggression LGBTQ people face in the state of New Jersey and, quite frankly, nationally on a daily basis.
Does it matter in this one case in Colorado Springs that the shooter identifies as non-binary? Is that a factor for you at all?
No, it's not a factor because, quite frankly, what we know about LGBTQ people is that we are raised in a society that also embeds us with our own trans homophobia, right? We are raised in societies where there is homophobia and transphobia, and many of us internalize it. And in internalizing it, we not only diminish our own health and make ourselves sick, but we act out in ways like this particular individual, if they are non-binary, may be acting out. So it makes no difference. It's the same structural social conditions that fuel hate within that person internally and externally to the rest of us.
Are public health officials, whether it's in New Jersey or your colleagues nationally, doing enough to make sure that we break out of that closet, break people out of those closets that are trapping them, like you said?
I mean, over the course of the last couple of years under the Biden administration, certainly things have moved forward, but we have to remember that the previous 4 years, things went back a very, very, very long way. There were policies enacted that basically enabled healthcare and other types of providers to discriminate. So we had to undo the damage of the previous 4 years. What I will say is this: it looks like marriage equality will become law of the land and will be codified by the Senate. But I want to remind our viewers of one thing. There should be 100 senators voting in favor of this. There are 30-something who are not. And so those 30-something who are not voting in favor of it are saying very clearly, not with words, but with actions, that the love of LGBT people is somehow lesser than straight people.
I wanted to pivot to something that you've done a lot of work on as well, public health, the COVID pandemic. Governor Murphy said this on our Ask the Governor show the week before this past week.
I've said this many times, we're going to hopefully have some news on this in the next week or so. We're going to do a post-mortem on how we responded to this.
So Governor Murphy says there's going to be a postmortem investigation. What do you think that should look at, and what would you suggest that format be?
Yeah, let me first say thank you to Governor Murphy for saying that, because we should do a postmortem, because the next pathogen is just around the corner, and we should be prepared for the next pathogen. And let me add one more thing. We're still doing a postmortem from the 1918 flu. So we're still learning on a daily basis. So to do something much more timely around COVID-19 is really helpful. What does it mean to me? If I were Governor Murphy, number one, look at your public health infrastructure. What went wrong there? What was the disconnect between the state and the localities? Number two, what went wrong with the messaging to people? Number three, what went wrong with the supply chain? Number four, how do we develop programs? Why weren't all of us lining up to get vaccines? And to that point, I want to urge Governor Murphy and all public health officials in the state of New Jersey and nationally to remember this. Human beings are not rational operators. The COVID virus, SARS-CoV-2, infects us. We, human beings, are the ones who create the pandemics. Why do we create the pandemics? Because we make decisions that are often not rational, and they're often based on our emotions and what feels good and some false beliefs. We have to be modern in our public health approaches, and that means addressing people where they are, not just assuming information alone will make a change.
All right, Dr. Paraleo Ketis, Dean of the Rutgers School of Public Health, thanks as always for your insight.
All my best to you, Alex.
Our best to you as well. As for you, stay with us. There's much more to come on New Jersey Power and Politics.